it should be self-driven. Our job is to show them, to tell them, not only show them, educate them. See, any changes in the whole world has come through education only. There is only one path. That's why I chose not to preach but to educate. Preaching is something I come and tell you something and go.
Every chapter has a journal. Every chapter he chronicles. There are beautiful nuggets at the end of every chapter. I think we'll talk about that a little down the lane, but
I did a wrong. I did young because nobody is there to guide me. Here now we are guiding people. Now I tell you, every person, the moment you read the book, you think what reset you need. That's the day. It's not that I'll do it tomorrow or I'll have a hypertension, I'll have a cancer, then I'll reset. Fine. I can reset today because today what I told you, our biology.
Or how do I know that I should reset now? Is there some signal that comes that, hey, Vamsi, today you reset, yeah, there's some problem. There's the opposite also that is also there, especially when it comes to surgery, because you're a doctor. I'm just bringing this up as well. A lot of people advise bariatric surgery for people who are obese, and especially they say that it works well and does work. Of course, from a medical standpoint, I don't want your suggestion because that is different. But from a cellular standpoint, from a GSHER standpoint, your organization, do you think there is an easier way to combat rather than going in for surgery or surgery?
No, I will as a surgeon also I'll advise surgery is not at all. We are playing with the physiology. As a surgeon also, I have now adopted this one because I personally don't like this one.
Bariatric surgery.
Bariatric surgery, I never recommend anybody. I don't like it also because people are getting results, but again, it is a short-term depot. And you are totally changing the physiology. And which is, see, body is been made in such a way, God has created, He has got everything. You talk about weight loss, you talk about this, everything has got a solution. You have to work. Why you want? Again, I told you that come to, they should not opt for a shortcut. It may be bariatric surgery only advisable to person who are moribund, where you can try. Their success rate is also not good.
Right.
When, those people who cannot breathe, or that surgery has been created for a certain group of people.
It's not for everybody.
Not for every obese person. That has been designed, the surgery was designed long back, and it has been, ideally should be done. But now because of people's demand, now many people with not fitting into the category also coming into the picture.
Right.
And they, again, if you look into them, I've been following many patients getting done. I'm not very happy with that. So bariatric surgery, I'll say for a normal person, no. Fine. And they have to go, because it is possible, reducing weight and taking, if you take
naturally
care,
through your
yes,
GSHER system, through the suggestions in cellular, it can work.
Yes. Once you decide I have to go for it and you follow certain protocol, naturally you will go back. We'll be coming up with that new protocol also in cellular, what a person can do, because we are tracking for hypertension, diabetes, cancer, every person.
We were about to get into that because hypertension, when you talk about stress, sir, and when we talk about food and everything, hypertension seems to be a very common phenomena.
Yes.
Even small children, they say, "You are making me tensed. Yes. I am getting tensed." What is happening?
Hypertension is a thing which has been neglected in our country. This is a disease. Everybody is happy with one pill, but you will be surprised to know that I was recently had a 1 month long program on hypertension. I gave the statistics. You will be surprised to know 59 to 60% of the population is affected by hypertension. Fine.
59 to 60% population.
And only 15% of the hypertension patients are under control. Undiagnosed, we do not know. So it is a big issue, and all the things because of what? What is hypertension? Your blood artery is getting thicker because resistance is becoming more. Essential hypertension.
Clogging of arteries. Yeah.
That is because it is of the pressure is the elasticity is losing. It's losing because of your what the chemicals are doing into your at that level. If you reverse it back, gradually all the things, there is a chances of coming back, and it has already been seen. If you look into, if you go through that book Reversing Heart Diseases they've done a lot of research on this. They have reversed back people with heart block also.
Oh, but
yes, with
blocks.
diet, the exercises and mindset. They worked for the 3 months to 4 months. They have cleared out 70 to 80% of blocks, gone. It's because we create it.
Right.
We have the power to regress it, but we have to do in a certain way. That way nobody is talking about. And we have started talking now.
Right.
Everybody is giving, do this, so that we are giving, in the modern medicine, we give you tablets.
Right.
In yoga, they will tell you, do this yoga. Somebody else will tell you, do this, eat this diet.
Yes.
But everybody is individual basis. Nobody is integrating all the things. When we integrate them, the results will be wonderful.
Especially if you're talking about this practice, because I know there's a lot of discipline in this whole process. Because when you're telling something, to practice is discipline. Now, one aspect that I'm looking at after the whole conversation about the whole integration of different practices is one has to be disciplined, and most of the times we don't see that happening in people. How do you bring about that practice through your Cellular protocols? Do you inculcate it somehow, push them towards it, or it's self-driven, sir?
It should be self-driven. Our job is to show them, to tell them, not only show them, educate them. See, any changes in the whole world it has come through education only. There is only one path. That's why I chose not to preach but to educate. Preaching is something I come and tell you something and go. I'll give you 1 hour lecture and go back.
I get motivated.
You get motivated.
Yes.
I want the moment you are inspired, you understand you are the person who is driving this, we have done this. So you will think, okay, I can also do it, it is fine. Now people get disheartened. Once they are diagnosed with hypertension, once they know diabetes, once they are diagnosed with cancer, they are disheartened. They know, okay, I am gone. Nothing. Because till now the teaching is like this. Or in alternative therapy, what is happening? They are giving them, you do this one, then this will happen. No, you have to educate them whether it is possible or not. What is the science behind it? So education can change. So that is the reason why we are working on creating a group of different professionals who will not be doctors, will not be paramedics, who will teach you, because there are this number. If I am talking today, or like me, there are 10 people who must be talking like this in the whole of the country. So if we integrate all these things together, and you can be an educator, then I think down the line, if I see, look into the things, 10 years down the line, we will reduce the burden of diseases. It's
Right.
going to help. Believe me, if we work together and taking people and educating them, creating the educators, then one day will come when the disease burden will come down. It is not, we have created it and we have the responsibility to bring it down.
Beautiful. I'm just touching upon one more point, sir. You spoke about reset, especially when it's going to be health related. You said there's a reset point, and I also read somewhere inside the book wherein you were talking about more of a reset from a health and a mindset standpoint. Can you throw some light into what reset means from the health point perspective in your book, sir?
Okay, I'll give you an example. What happens when your mobile gets stuck? We used switch, you
Hard
use the
switch,
reset
push
button.
and reset it. Yeah.
What is reset? Reset is bringing that thing into the same combinations,
Right.
which was working before.
Default settings.
Default settings.
Yes.
It brings a default setting. So if I think today, if like I give you example, when in 2010-11 I had a problem, I started thinking what brought me to this level.
Right.
So I have to 15 days, you will not believe, 15 days till my angiogram was done. I was thinking every day, what was the thing which has brought me? I had a diary. Fine. I should write in what I did in last 10 years. So I found out that there are a lot of things which I did which I was not supposed
There
to.
was some soul searching kind of activity you did.
I was not even getting sleep. I was not eating my breakfast. I was missing all these things. Now I have to work on all these things. So I know, okay, here I am doing. So I am reset. I'll go back. I'll eat in the right time. Reset. I'll go. I'll sleep for 4 to 5, 6. It is 6 hours to sleep. I'll reset.
Right.
So I will reset myself accordingly. So once I come to that level of thinking, yes, I will do. Then comes what I should do to bring it back. Then revive comes.
Right.
Here you have food, your all the procedure, all the tools we will be using it. Breathing, your food, your mindset, your meditation, everything comes into that picture.
Absolutely. Because this reset phenomena is something that amazes me when I read the particular chapter, and especially who needs a reset, sir? Because everybody will not require it. According to you, when do we reset? Is there a point wherein we think, okay, this
Yes,
should happen?
we
Because
have-
you had a point wherein you had a slight issue, and then you said, hey, I'm going to reset now. Should we do it at that juncture or before that, sir?
before that. I did a wrong. I did wrong because nobody is there to guide me. Here now we are guiding people. Now I tell you, every person, the moment you read the book, you think what reset you need. That's the day. It's not that ki I'll do it tomorrow or I'll have a hypertension, I'll have a cancer, then I'll reset. Fine. I can reset today because today what I told you, our biology.
Or how do I know that I should reset now? Is there some signal that comes that, hey, Vamsi, today you reset, yeah, there is some problem?
You have to do that. You know in this book, Aryan writes a journal every time.
Every chapter has a journal. Every chapter he chronicles. There are beautiful nuggets at the end of every chapter. I think we'll talk about that a little down the lane, but let's say the journaling.
Journaling. So I tell you, the moment you start journaling, there is only one point where you can think whether I need a reset or not. You have to start I do journaling every day. If you go go through this, you will see that's why I put journaling here. So journaling is a thing I should know what I am doing because body gives you signals. Our body cry every day. We ignore it. You tell a person who is not told. My son used to tell me, Baba, my foot is now singing. When I am doing I go 4 or 5 hours. But then that is a signal. But can you change your shoes? That's a simple thing. So I reset. वो भी एक reset है.
Right.
That is also a reset. So before it has happened anything, it has got any problem. So I ask him to do that. So the moment you start asking questions, you recognize your warning signs. Because before my problem came, I had a lot of warning signs which I ignored.
Right.
You must be having something which you are ignoring now. The person who is reading it, he must be having something which he is ignoring now. So now to recognizing that warning signs, which your body is so nicely, God has created our body so nicely. Your headache is a warning. Your fever is a warning. Fine.
Exactly.
Your loose motion is a warning.
Exactly. And headaches, the first thing is you take a painkiller, you take some Dolo or something like that. We do
warning.
that.
Your body is crying for help. That is the time to reset.
Right. But headache is a phenomenon. I don't know why I have a headache. For instance,
You don't know, but your doctor must be knowing.
Yes.
But once you understand, you must be knowing. You will know. Your headache will be there because your body is crying. Somewhere your brain cells are not getting the proper oxygen.
Exactly, because sir, after, let's say that every day after 9 to 10 hours I come back home, till the time I'm traveling, sir, I have no issues at all. The moment I enter home, there is this headache that comes in, and I think that is stress. Is it true that is stress, or is it something else?
You have named it as a stress, but what stress? It is stress, or it is a whole day of hustling the whole day. You have somehow spent less and less. Your brain is getting less and less blood. Somewhere there is a problem where your brain is not getting.
No, till the time I'm outside, I have no problem at all.
Maybe that is the time you are coming. That is the first time you noticed. Within this total period, you have not noticed your headache. You have not, because you are busy. I told you now, we don't remember things. When you are in busy things, many other times, you are going hurriedly somewhere, there is some cut. You never noticed. But when you come home, you say, there is a cut. Have you ever? It has happened to you?
It has happened to me multiple times.
Many times.
Multiple times.
Why you didn't notice that during that period? Because
I was focusing on something else.
Yes. That is the thing. When you come home, your body is now coming to the point where it is recognizing that there is something going on. It is crying. There is something wrong here. Do it. Do something for me. And you are not doing it. You think it's a headache. I take a pill and khatam kare isko. But now you have to think.
Because we all expect instant solutions, sir. Exactly, because I have a headache, I'll take, okay, one tablet, I'm fine. But you're saying that is bad.
That is a warning sign.
That is a warning sign.
Yes, there's a time to reset.
Reset is happening when this becomes a common practice every day.
Every day.
Every day. Am I right, sir?
Yes, every day.
And one more aspect that I also notice, especially among young folks, is most of them have this issue with their gut health, especially the constipation or focusing more. They say that after coming home and having a good dinner or something, still they find it difficult to digest and so. And this is not with the older people, but with the younger folks as well. What changes in terms of food, yes, but in terms of other practices could be got into the system, sir, to make them better with regards to the gut health.
See, uh, gut health means what? Your food will get digested. I told you from the beginning, we have to chew the food first very nicely. So because the moment you make it paste, it will go to the stomach, it will push the blood because it is a system.
Right.
It's moving. Now the how our food get digested because of this bacteria, you have to change. You have to again nurture those bacteria.
Good bacteria.
Because you have already destroyed them
Right.
because of food habit. Fine, because of fast food culture, you could talk about the stress every time. A surge of adrenaline, it kills your bacteria. Fine. So you have to change and you have to start taking some pre and probiotic like food which you will get.
I hear a lot of people saying that fermented rice
Yes, good.
is good. Is
Yes,
it
very
really good?
Yes, really good. Because fermented rice is our cultural, if you
Yes.
say it's a cultural food. We used to eat it before also, now also we have to eating it. We are
And,
almost we have stopped eating it.
As a matter of fact, it became a poor man's diet at one point of time, saying eating fermented rice is not good. But now I think even
No.
doctors and a lot of people are advocating fermented
Because we have now we
rice.
know the science behind it.
Right.
Pickles. I tell you, one example. Pickle is one of the best fermented food you ever get in
Is
your
it?
home.
But it's supposed to increase your blood pressure or something. That's not true.
The-
At moderation.
Moderation. You have to, because this much of pickle can have millions of bacteria.
Because of the fermentation
Fermentation process. Fine.
A
And
small
now you have
lime pickle
fermented food.
will have.
Yeah. This is the like now people ask me, sir, should we take curd or not? Milk and milk product we always say no, in a sense, because milk is not a protein which our body can digest. So the things which our body doesn't digest, it keeps it for a longer time.
Right.
It try to ferment it because it cannot digest it. So this fermentation process, it kills lot of our good bacteria. Though it has got X amount of good bacteria with the curd, but because it is not getting digested, it kills more number of gut bacteria.
So curd rice technically is not a good.
Not a good rice. So because it is culturally so many things, milk is our cultural symbol. So it is very difficult to make. But I have cured thousands of patients by just stopping this milk and milk product. Their pain abdomen gone, totally vanished. Everything normal. They used to come for this much of papers, and I used to take a history of them. What are they eating? Then I found every patient.
Right.
This is there.
And this is proven. This is tested and proven.
Tested and proven, and it is a science everyone knows since last so many years. But see, milk industry is a billion-dollar industry. You cannot say anything against it.
And most of us also drink a lot of tea, coffee.
Cultural
Thing. Chai,
Yeah.
without your cup of chai or coffee, like very difficult.
chai, coffee has got very little milk. But the glass of milk you are talking about,
Okay, milk or
Milk.
even paneer for that matter.
paneer, all these things are really one of the biggest cause of chronic abdominal pain. In surgery we tell it chronic abdominal pain. You may not find any cause of this, but the patient comes with the pain. You stop this, you change your food habit, the pain is vanished. 7 days, 10 days. The people think I do a miracle, but I don't tell them that you have done the miracle, not me.
So one more major challenge that I think most men have is bloating or gas, passing of gas. So that is also related to food, am I right, sir? What are the steps that one can take to control that? And it is very important because in social situations it becomes a problem. Can you please
Yes,
suggest something like this?
Gas. This is a problem. Every patient coming to my OPD, they talk about this. Now, gas means your the gas which, because normally during the digestion, a lot of gas being produced.